Hello, everyone. Welcome to our Family Matters series. We're so happy to have you join us for this episode. Our topic today is a very interesting and relevant one for both older adults and their families. Today, we're going to discuss the topic of brain health coaching. So, we'll talk about what brain health coaching is and also how it's beneficial to optimize cognition and brain health with age. I'm really excited about this topic because I really think brain health coaching is kind of a hidden gem. It's a resource that is so beneficial, but that a lot of people really aren't aware of. So, for this episode, we are joined by our expert, Breden, who is a certified brain health coach at the National Brain Health Center. Welcome. Thank you so much for being here.
Hi, Jen. Thanks for having me.
Okay, so let's just jump right in. Before we start talking about brain health coaching, could you just start by explaining what brain health means? I know it's a term that gets used a lot, but what exactly are we talking about when we say brain health?
That's a great question. So, when we talk about brain health, we are talking about the cognitive skills and cognitive functions that are required to live an independent lifestyle. So, that includes what we call activities of daily living. So, just the ability to perform, just like it sounds, the ability to perform the things that you need to do on a daily basis.
Great. That's very helpful to give our listeners some context just as we go on to talk more about brain health coaching. Um, and so, speaking of brain health coaching, would you mind just taking a moment to tell our families a little bit about yourself and your background and your role as a brain health coach?
Yeah, absolutely. So, I studied psychology. I got my bachelor's degree in psychology, and I have been working with Dr. Mansbach, who I know you're familiar with from the BCAT. I started working with him actually as a research assistant. So, a lot of the tools for intervention and assessment that I use now, I actually got to be involved in the initial research for them for their development.
Oh,
So
that's neat. Okay.
yeah. And then over the years, I've used those tools with patients in both inpatient and outpatient settings. So people who live in nursing homes and assisted livings, as well as people in the community. I get to use these tools with them to help them um, maintain the highest level of independence that they can.
That's great. That's great. Okay. So then before we get into more details about actual brain health coaching, maybe you could take a moment to explain why it's important to address brain health. I mean, really any time, but particularly during the aging process.
Absolutely. It's important for a lot of reasons. There is, of course, a difference between um, forgetfulness that comes with what we call regular aging. In other words, it's normal. And then there is a type of forgetfulness or decline that someone could experience that is a sign of just something that could be more concerning, something that needs attention. And it's important to assess that when someone's aging for a few different reasons. One is that it provides you an opportunity for intervention. So if someone looking at brain health when someone age helps them distinguish if what they're experiencing is normal aging or not. And if it isn't, then it's a perfect time to start working on what we call brain healthy behaviors. And I'm sure we'll get more into that, but it's a very pivotal time that provides people with the opportunity to take action.
Okay, well, very well said. Okay, so would you say that there are any red flags that people could look out for, like changes in memory, for example, that might signal a need for more or further, I guess, cognitive or brain health evaluation?
Yeah, so I would say that, the expression changes in cognition can seem kind of vague and broad.
Mhm.
And there are things like some things are normal, like maybe it takes you a little bit longer to come up with the answer to a question or a name. But if you find yourself having trouble remembering things that were previously familiar to you, I would say that is one kind of red flag, just something to look into. Um, and then pursue assessment in that case, and that will, so it's just sort of a signal, and that way you can take action. Does that answer your
Okay,
questions?
it sure does. So the occasional, I forgot where I put my keys, maybe just part of normal aging. But as you said, if you're constantly forgetting things that were very familiar to you, at one point, that could be a signal that you need to pursue further
Yeah,
evaluation.
exactly. And if someone wasn't sure, I would just suggest some sort of evaluation. Even like the My Mem Check assessment that you all have at BCAT is just a way to determine if a more thorough evaluation is needed.
Okay, and we could put that in the notes for this episode, the link to my mem check, which is just
Great.
a self-evaluation that people can take to look at their own cognition, like
Hmm.
memory. Okay.
Yeah.
Great. So then that brings me to another question. Is there an ideal candidate for brain health coaching? So, in other words, does one have to already have cognitive impairments in order to participate in brain health coaching? Or is it something that's appropriate for people who really just want to be proactive in addressing their cognition and brain health to prevent it from declining?
Yeah, absolutely. So just as you said, I think brain coaching is a great option for people in both of those scenarios that you described. So brain health coaching can support people who are already experiencing some cognitive decline because it can slow down that decline, and depending on where they are, they can actually gain a little bit of ground back. But it's also really useful for people who haven't experienced any decline as a way of what we call building cognitive reserve that will defend them against any potential future decline. So, in other words, it's never too early to start protecting your brain health.
That makes perfect sense. Kind of like physical exercise. You wouldn't wait until your muscles were beginning to atrophy to do physical exercise. You would try to keep up with it so that that doesn't happen.
Exactly.
Okay, perfect. Um, okay, so let's talk about the actual cognitive coaching process itself. We've talked about, why people might need it, and who would be a good candidate for it. So before you begin coaching with a client, is there a process by which you formally assess their cognitive skills? And if so, can you tell us more about that process and then just how you would use that information to create their coaching program?
Yeah, absolutely. So, before I would get started on any type of cognitive exercises or goal setting with a client, I would want to do some kind of cognitive assessment. And that can be a very thorough, full battery of tests, or it can simply be a short screening that we do, just to give me a sense of where they are cognitively, because that will really shape the type of goals that we set, or not goals, but it will set it'll set the areas of concern, and it'll also help me get a sense of how um, complex of cognitive exercises I can do with them.
That makes sense. So, I mean, if somebody has very little cognitive impairment, you're saying you could do more complex exercises. But if somebody is
Mhm.
starting off with, say, pretty severe memory deficits, you're not gonna, give them super complicated exercises that are just gonna frustrate them.
Exactly. We want to make sure it's a level that is challenging, but as you said, not frustrating.
Perfect. Okay. So that's a good segue into the next question that I have for you. So you do that initial evaluation to see where people are before they begin the coaching. And then, Allie, if I'm understanding correctly, coaching involves two main things. So it involves doing cognitive exercises with the client, and also coaching them on lifestyle factors to promote positive brain health. Is that correct? Okay.
Yes.
So let's start with the cognitive exercises piece. We just talked a little bit about it, but perhaps you could explain a little more about what kind of exercises a client could expect to do with you.
Mhm. Yeah, absolutely. So we have a app that we use called 15 for Me, where there are a series of exercises that look at two main categories. The first one is obviously memory, and the second one is executive functions. So they kind of feel like games and they kind of feel like puzzles, but the difference with these exercises is they are evidence-based. So they've been studied and actually proven to slow down decline and, as I said earlier, potentially can improve someone's cognition.
Okay, so these exercises are going to, and this is absolutely no slam on crossword puzzles. I enjoy doing crossword puzzles, they're fun. But what you're saying is this is more than just, say, crossword puzzles or, maybe brain exercises that you might buy in a book at, a retail store or something.
Exactly. I like to do the Wordle as much as everyone, but as far as I know, it hasn't been studied for effects on brain health.
Okay, so when you're saying evidence, when you're saying evidence-based, you mean these exercises have been researched to show a positive impact on people's memory, and you said executive function.
Exactly.
Okay. Okay. And just a real quick, you when you said executive function, just in case our listeners don't really know what that means, is that just higher
Yeah.
level thinking skills?
hmm Exactly. Executive function is any, it's often referred to as like the CEO of the brain. So it's your ability to problem solve. It involves working memory, which is um, essentially the ability to hold and manipulate information at the same time.
Okay. Perfect. And those things are super important to maintain that good cognition throughout the lifespan. Is that right?
Mhm. Yes,
Okay.
exactly.
Okay, that's so interesting. So it sounds like the cognitive exercises are evidence-based, research-based, but it sounds like they're also kind of fun, just from what
hmm
you said.
Yeah,
Okay.
I think they're.
Um, right, right.
Mhm.
Okay, so you talked about the cognitive exercise piece of the coaching. Could you also give some examples of some of the lifestyle factors or habits that you address during brain health coaching?
Yeah, absolutely. So I use a model called the BH7 or Brain Health 7 model of what we call brain healthy behaviors. So that is cognitive exercise, as we've said, as well as physical exercise. It looks at sleep, diet, social engagement, mood, as well as I forget if I mentioned sleep, so making sure someone's getting enough sleep.
Okay.
Um, I think that's all of them. Centered breathing, I'm not sure if I
Okay.
mentioned that one. But all seven of those have an effect on someone's brain health. So in brain health coaching, we would kind of examine and sort of give them like a score in all seven of those categories. Not because it's, pass or fail, but it's just getting a read on if there's area or if there's room for improvement in any of those categories.
Okay, wow, that's great. So you take a deeper dive into all of those seven lifestyle factors that influence brain health, and then you give people like suggestions to work on how to work on or improve those areas if okay.
Exactly. So some of them, I would say the two that we focus on most in terms of actually working on them together are the cognitive exercise as well as the centered breathing, because for a few reasons, those are two of the areas that are included in our 15 for Me app. So that makes it easy to look at them together. But also because those are two that most people aren't necessarily familiar with. So, in other words, we all kind of know that it's important to eat healthy and exercise and get enough sleep, have take care of your mental health, stuff like that. But when it comes to cognitive exercise and centered breathing, a lot of times people don't really feel like they know what they're doing. And so it's more important to have someone walk you through that. But for the others, I would look at them, as you said, and provide recommendations and provide support and suggestions for more discipline and accountability in those areas.
Okay, okay. Well, and then that sort of segues into another question that I had. Do you typically give clients homework or exercises to do between sessions, or they just do it in the session and then they're done until the next one?
Mhm. I do. Sometimes it's very specific and sometimes it's more open-ended. I kind of let them decide what exactly they want to do. But the evidence shows that when it comes to cognitive exercise, the recommendation is 3 to 5 times a week for 15 to 30 minutes at a time. And typically in brain health coaching, we meet at the most once a week. So that would just mean that I would ask them to sit down on their own independently for 2 to 4 additional times for 15 to 30 minutes and work on some kind of cognitive exercise. Or if one of the other 7 areas is one they were struggling in, I would give them some specific recommendations for that as well. But it's very unique to every client depending on their needs.
That's great that you're tailoring things to what people's needs are. And that's also, to me, that sounds very doable. The homework, it's not hours and hours of things that people have to do in order to improve their brain health. I mean, 15
Mhm.
minutes even every day is really not that much and really seems like it wouldn't be that difficult to incorporate into your daily routine.
Yes, exactly. It's something that I always think about is it might seem sometimes when we recommend these exercises to people and they want to know, well, how long do I have to do this? It's kind of like how when you go to the dentist and they tell you that you need to floss more, you don't say, well, how long do I have to do that? It's just something that you should keep up with in order to
Right.
maintain your health, whether it's your oral health or your mental health or your brain health.
Yeah, yeah, that's a really great analogy because people are so in the habit of, going to the dentist and taking care of their teeth, but I think people don't realize that they should also be in the habit of doing cognitive exercise for their overall health. Um,
Exactly, because our brain is a muscle, right?
yeah, that's great. That's a really great analogy. Thank you, Allie. So then let's say a client has 4 sessions of coaching,
Mhm.
just as an example. How do you know how someone is responding to that coaching? So in other words, how do you measure their success with coaching?
That's a really good question. So there's kind of 2 ways to measure the success. We kind of as a general rule, we will give people a formal cognitive assessment. People that we're working with for extended periods of time, we'll check back in every 6 to 12 months and see how their scores have changed. So that's kind of a more objective way to actually determine based on numbers. But the so let's say someone scores at a certain level and then 6 months later they score higher. They're going to see those changes in their everyday life. And if they personally don't notice it, loved ones typically will. They'll notice that they're remembering things a little bit better, that they're not struggling as much, they don't need as much support. So, especially, I think about some of my clients they get a little bit of test anxiety, and I always just remind them that the actual score on the test, it's just going to be a representative of what you're already experiencing. So for those people, I remind them there's no need to be nervous. It's not about a test. It's not about pass or fail. It's like a vital sign. We're just taking a look to see if there's been a change.
Okay, okay. And I know from conversations with you, Allie, that people really report positive changes from cognitive coaching. Like you had mentioned, that sometimes they notice a difference in their everyday life. And I know, from having spoken with you before, that people do say that they see improvements just on a day-to-day basis, which is really great.
Yeah, exactly.
Okay. So then, Ellie, just some logistical questions that listeners may want
Yep.
to know the answers to if they're interested in coaching. So first of all, the cognitive coaching, is it in person? Like, do people have to come to the office for it, or can it be done over Zoom, like over the computer?
Right. We can do it both ways.
Okay.
Typically, I find that doing it on Zoom is easier just because it eliminates any travel concerns. Often, older adults maybe don't drive anymore, so it's just less to coordinate if they can do it from the comfort of their own home. A lot of times, right off the bat, they will be nervous about using Zoom. They might not be familiar with it, they may never have used it before, but often once we get started and they get the hang of it, they find that it's really not as stressful as they may have thought, especially if they have a family member who can help them kind of stay organized and get them logged in. Um,
Okay.
but either way, whatever is pretty much whatever people's preference is. Our center is located in Maryland. So for
Okay.
anyone who's non-local who might be interested, yeah, there's no reason why you have to be local.
It's great. So I could be in California and still do brain health coaching.
Yeah, absolutely.
Wow, that's really wonderful that it's so accessible to everybody. Okay, so if one of our listeners wanted more information on brain health coaching or wanted to sign up for brain health coaching, where would be a good place for them to start?
A great place to start would be to email us at that address, and maybe we can put it in the chat or something as well, is resourcecenter at counterpointhealthservices.com. It's a little bit of a
Okay,
long one.
that is okay. So if anybody didn't get that, don't worry. We'll go ahead and put that in the comments under the video. That's great. So they can just email and then someone will get back to them with more information and more details.
Exactly. With the next
Wonderful.
steps.
Okay. Ali, thank you so much for taking the time to be here today and for sharing all of your knowledge on brain health coaching. This was really great information, and is such a great resource for people who want to maintain and improve their brain health and cognition with age. And of course, thank you to everyone for joining us on this episode of Family Matters. We'll see you next time.
Yeah, absolutely. Thank you everyone for being here. And thank you, Jen, so much just for providing me with an opportunity, like you said, to kind of get the word out. It is something that I feel like could be helpful for so many, and it's just something they're not even aware of.
I totally agree. All right. Thanks, everyone. We'll see you next time.